you. Good afternoon. My name is Dr. Andrew Baker, and I'm the Chief Medical Examiner for Hennepin, Dakota, and Scott counties. My office provides all death investigation and autopsy services to those three counties. In addition, we perform autopsies on behalf of the coroner for Rice County. Beginning with a death that occurred on January 30th of this year and continuing through February 17th, my office has identified 5 carfentanil-related fatalities in the counties we serve. Beginning just a week ago and as recently as 2 days ago, my office received word from our toxicology laboratory that all 5 cases were confirmed positive. The reason for the lag time between the deaths and the confirmatory testing stems from the difficulty in detecting carfentanil at autopsy and the need to utilize specialized reference laboratories in confirming its presence in postmortem specimens. Currently, routine drug and alcohol screens, although they're quite comprehensive, do not detect carfentanil nor many of the other synthetic and novel opioids that are being sold with or as heroin. In each of the 5 carfentanil-related fatalities we have detected, there was strong historical evidence and seen evidence to believe that we were dealing with an opioid overdose. It was only when our routine toxicological testing did not provide a cause of death that we turned to a reference laboratory to screen for novel opioids. We rely on a reference laboratory because carfentanil can be fatal at very low concentrations in the blood, and very few laboratories are currently equipped to test for it. Thanks to the dedication of my investigative staff and the vigilance of my physicians, these 5 carfentanil-related fatalities did not go undetected. We have at least 4 to 5 additional fatal cases in which we suspect the possibility of carfentanil, but confirmatory testing is still pending. The 5 fatal cases we have confirmed are decedents who range from 23 to 43 years old. But for their opiate addiction, all of them were otherwise free of disease at autopsy. 3 of these 5 cases occurred in Minneapolis, 1 case occurred in Dakota County, 1 case occurred in Rice County. The medical examiner has alerted law enforcement, the Drug Enforcement Administration, the Minnesota Department of Health, and our clinical colleagues who work in emergency rooms, poison control centers, and as first responders. In addition, we have alerted the other medical examiners and coroners around the state of Minnesota to be on alert for the possibility of carfentanil-related fatalities in their jurisdictions. Carfentanil is a synthetic opioid related to fentanyl, but many times more powerful and more dangerous. Our reference laboratory reports to us that carfentanil is 10,000 times more potent than morphine and some 100 times more potent than fentanyl. Carfentanil is not approved for use in humans. Clusters of carfentanil-related fatalities have occurred in other large cities and states since mid-2016, but to our knowledge, these 5 cases represent the first confirmed cases in the state of Minnesota. Carfentanil poses a very serious risk of death to opiate abusers. Because it can be dangerous at low concentrations, the possibility of inadvertent or unintentional exposure to law enforcement, first responders, and emergency room staff does exist. For all of these reasons, the medical examiner's office felt it was important not just to inform the public of this new hazard, but to ensure that our colleagues on the front lines of saving lives were also aware that carfentanil has now been confirmed to be in Minnesota. Thank you.
Good afternoon. My name is John Cole. I'm an emergency physician and medical toxicologist at Hennepin County Medical Center, and I am the medical director of the Minnesota Poison Control System. As Dr. Baker stated, carfentanil is an extremely potent medication. It is FDA approved for the use in animals only, and its use is to specifically immobilize large animals. So this is on the list of drugs that's used to incapacitate animals the size of elephants so that medical procedures can be done on them. For example, a 900-kilogram elephant can be immobilized by just 2 milligrams of carfentanil. This drug is ultra potent, and the safety of it in humans is completely unknown. There is very little human literature on exposures to carfentanil, and it is unclear at this point what threat this really represents. We know enough to know that this drug is ultra potent, and we know enough to know that we should be very concerned. In terms of the safety of our citizens, prevention is critical. We do not condone the use of recreational opioids in any way, but if users are to use, using alone is more dangerous than perhaps it may have been in the past. In addition, having naloxone, which is the antidote for opioid poisoning or overdose, at hand is critical if this drug is encountered. Naloxone is extremely important, but the way in which opioid poisoning, including carfentanil, is ultimately lethal is because it stops the body from it stops your ability to breathe. Therefore, rescue breathing or bag valve mask ventilation from rescuers, EMS, police, first responders is the most critical step to saving any victims at the scene. 911 should be activated early, and we urge those in the using community to remember Steve's Law if and when they do so. Administering naloxone to a potentially overdosed patient is also critical, and remembering that naloxone can be given both via an injection and through a nasal spray is critical as well. Carfentanil is extremely potent, obviously. It's 100 times more potent than fentanyl and approximately 10,000 more times potent than morphine, but it is unclear exactly what that means for the overdose community right now, as the prevalence of carfentanil in the heroin supply is unclear right now. And last, if there are questions from anyone, whether it's the lay public, medical providers, or otherwise, poison control is available 24 hours a day, 7 days a week, all hours, of course, to answer questions, both for active patient care and to clarify what is known about this drug at 1-800-222-1222. Thank you.
Well, good afternoon. My name is Drew Evans. I am the superintendent of the Bureau of Criminal Apprehension. As the doctors have noted today, this is a new and dangerous drug to the state of Minnesota. Carfentanil, as said, is 10,000 times more potent than morphine, and it will kill you. The use of opioids like fentanyl is a health crisis for Minnesota. It's a law enforcement crisis, and it's a crisis for all Minnesotans. We need to work together to address the crisis with information, education, and enforcement. And our message today is if you are addicted to opioids or have a loved one who's addicted to opioids, we want you to get the help that you need, because we want to save your life. That's part of the reason the governor's provided in his budget proposal this year to provide additional agents, analysts, and scientists at the BCA to work on this important problem in the state of Minnesota with all of our partners here today that you see. In 2016, BCA agents worked over 28,000 hours working narcotics cases across the state of Minnesota, and we're seeing a steady growth in drug seizures, drug arrests, and drug victims, as all of us standing here today have seen across all of our communities. This is not just a city problem. We're seeing this across the state of Minnesota, seeing fentanyl, heroin, opioids, and now carfentanil. The BCA lab saw a 47% increase in the number of narcotics cases in last year alone submitted for analysis. We saw in the last 6 months 11 different cases that contained carfentanil that is mixed with various drugs such as heroin and other fentanyl as well. We're also seeing a rise in fentanyl cases across the state of Minnesota submitted to the laboratory as well. In fact, this quarter alone, first quarter of 2017, we've seen approximately 25% increase in the number of cases we've tested. So as a state and a community, we need to recognize this crisis and work together to take the steps to stop it. Thank you.
Good afternoon. My name is Bruce Falkins. I'm the Deputy Chief of Investigations Bureau for the Minneapolis Police Department. I'd like to just quickly say thank you to my colleagues in law enforcement, our partners in the state, in the federal government, and our medical examiner's office, our public health folks. It's the work that and the communication that happens between all of the folks standing here that really help us bring cases to resolution, and also to alert the public of this really severe public safety issue of carfentanil. Unfortunately, we've had 3 of the confirmed deaths of carfentanil in Minneapolis. We have one of our homicide detectives is assigned to all 3 of those cases now. He's going to be collaborating with the other jurisdictions, Faribault and Apple Valley, to deep dive into any information they have on their cases, to work together with those folks to try to identify the source of supply for that carfentanil. We're also mobilizing and utilizing our task force people that are assigned with the DEA, the FBI, and anybody else that does narcotics enforcement in the city of Minneapolis to try to get out the word to looking for intelligence information as it comes in. Again, this is a public safety message. There's those folks in our communities that are vulnerable to opioid or heroin abuse, and we're really asking that those folks and their friends and family and loved ones that really watch out for each other, because this dangerous drug is fatal, and we really don't want to see anybody fall victim to it. So again, thanks for the partnership that we have with all of our friends here and our colleagues, and thank you guys for coming out and helping us spread this urgent message. Thanks.
Hello, I'm Chief John Rexigal with the Apple Valley Police Department. Thanks for coming out and covering our story here. It's important to get this message out. My presence here, obviously, we've dealt with some tragedy in our city. And what I want to point out is this is not something that's just affecting the inner cities. This is everywhere throughout the state of Minnesota, and the entire region is affected. I also want to offer assurance that all of us in law enforcement are going to be collaborating to try and fight this new threat to our communities. Thank you.
Guys, we'll open up for a few questions. If you could, again, just identify yourself and what agency you're with, and also who you'd like to address your question to.
Scott, can someone answer us where, Edgar Linares with WCCO Radio, where is this drug, who got it, or how did it get into Minnesota? Does anyone have that information?
I knew we'd be sure. Introduce yourself.
Yes, my name's Ken Solik. I'm the Assistant Special Agent in charge for the DEA here in Minnesota. As far as where the drug's coming from, carfentanil, the majority originates over in China. The majority does. Now, where it goes from there, it's different areas. It can be purchased, it can be bought, as we know, over the internet, on some of the illicit sites, some of the dark web areas, in smaller quantities. Larger quantities are usually brought in through the traditional drug routes with the Mexican cartels, and then they are either diluted in heroin or pretty much any other opioid type narcotic, and then they're transported throughout the United States.
And Matt Sedgwick from NPR. Do people know that they're taking this specifically, or is it found laced with heroin? Are people knowing what they're getting on it?
Most of the intelligence that we have, based on our investigations, are that people do not know that they are taking carfentanil. They are seeking something similar to heroin, if not heroin. They're seeking the opioid high, and carfentanil just happens to be the strongest one of those types. Oftentimes, even those people that are actually bringing it in, distributing it on the streets, they don't know that they have carfentanil. So, again, they're looking for that particular characteristic of a narcotic, an opioid, to introduce into, the heroin addict system. And unfortunately, with carfentanil, as the doctor is discussed and toxicology is proven, it is so strong that there is no way that you can dilute it enough for human consumption on a level that is safe for a human to take. So therefore, that's why it's rather rare. That's why it is significant. That's why we are here today to put the message out, the dangers of this carfentanil. The same can be said of most opioids, though. Go ahead.
Channel 5. Question, how much are we talking about that can literally kill a person?
That can kill a person?
Yes.
It would almost be microscopic. When you talk about, as the doctor referenced, a couple milligrams for an elephant, you're talking a couple specks of salt. So that's for an elephant, a couple specks of salt. For a person, obviously, it's significantly less. When you're dealing with amounts of this drug, we're talking micrograms, nanograms for usage. So.
Hey, Ken, David Shannon from the Star Tribune. This seems like a stupid question, but if somebody's producing a drug that is going to obliterate their demand, I know it wasn't meant for human consumption, but why, I guess? I mean, maybe that's just a hypothetical question.
Well, I think to answer that question, you have to look at why are people abusing heroin, why they're abusing fentanyl. Again, once you become addicted and once you cross that line and travel down that road, You're always looking for something bigger and better. And that's where carfentanil, at least in the minds of some in the drug world, that's where it comes to play. Also, of course, there's a profit margin. It takes such a small amount to get that same effect as that you would from heroin or from any other opioids, that for a small investment, even though the amount is so small, and then once you mix it into some substance, your profit margins are there, at least for a small time, because like you just pointed out, the chances of the overdose, the deaths, you're not going to have a whole lot of repeat customers with this stuff.
What are the dangers to responders who come across somebody who has taken this drug, they're out, they offer CPR? What are the dangers to them?
Sure. It'd be dependent upon exactly what they're dealing with, as far as is there any leftover substance left? Are there exposed needles? Pretty much the exposure would be the same for any kind of narcotic. We're not dealing with anything different. We're just dealing with something that's more potent. That's all. So any precautions that should be taken for any narcotic, for any kind of suspected overdose death, should be taken with carfentanil, with the understanding that chances are you're not going to know you're dealing with carfentanil. So you're not going to know that you're dealing with a drug that has this kind of level of lethality. So.
Can Narcan help with that situation?
That question would be better for the doctor, but I know in instances that we've dealt with, Narcan can help, but again, depending upon your dosage level, when you're dealing with this type of drug, it may not be enough. And it may not be enough with other fentanyls and fentanyl analogs also. Go ahead.
Hi, Iris at Fox Time. Good to see you again. I just spoke to you in August about the fentanyl problem that we just discovered was an issue here in Minnesota.
Sure.
How frustrating is it that here we have carfentanil, something far more potent, already in our supply and already claiming at least 5 people's lives?
Sure. Well, obviously it's frustrating. In the drug world, any type of new product is always going to be frustrating. It seems like at some point we are chasing that dragon, we are chasing that dream of where we don't have to deal with these kind of horrific accounts. But you have to understand, too, that the investigation has just started. This could be something, a one-time incident, that somebody got a hold of something that they shouldn't have on the internet, and it was put out there and it exposed people. We don't know what it is yet. This is day one of the investigation, so hopefully we'll have some more news for you. Hopefully we'll have a successful conclusion to the investigation.
Chief Wilkins, are you seeing any similarities in the 3 deaths in Minneapolis?
Unfortunately, folks that are addicted to opioids or heroin, and like the doctors have said, is they may not know that they're not out there asking for carfentanil. They just got the carfentanil, and that's what caused their deaths.
Not a particular area of the city where they were found?
No, it's all over.
Any other questions? All right, thank you guys so much for coming. We appreciate it.